Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. But let's begin with the illusion of the week. For this week's Root Tip illusion, I'm going to take this brand new 27 gauge needle and push it directly through the back of my hand just as hard as I can possibly push. Watch carefully, you will not believe this. 1, 2. 1, 2. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Well, I certainly hope you enjoyed this week's magic trick. Right now, Root Tip of the Week. Today's subject is pain. I woke up this morning with a splitting headache, and I just couldn't stop the pain. So let's talk about dental pain, referred pain, splitting headaches. Well, sticking a needle through the back of my hand turned out to be a painful experience because as I was preparing the trick you just saw, I accidentally stuck the needle in the back of my hand. And that gave me a thought for this week's Root Tip of the Week. It's all about pain. Today I want to talk to you about the psychology of pain and how the patient's perception can influence what they actually feel. It's not only important what the patient feels, it's important what the doctor and the staff feel. If we believe that the patient is going to have pain, we can convey that message to them subliminally, and they probably will. I always tell my patients as they leave the office, you will probably have a 2-aspirin toothache. Take whatever you take for a headache, and if you need something stronger, call me. Then I give them my unlisted phone number on the back of a business card, which reassures them, and I tell them you can call me day or night if you have a problem. Now, since I've started doing that, I've had 0 people call me to have some more pain medication, just because they know that they can get it if they need it, and they are comfortable with the fact that they're going to have a little bit of pain. They probably don't have as much as they would otherwise have. A study done a number of years ago took a group of people, and they would find out how much the perception of pain caused an increase in the amount of pain. They would show a patient a scalpel, blindfold them, and then take a feather and run it across their skin, and the person would swear that it was a scalpel cutting into their flesh. In another experiment, patients were shown a pot of boiling water. They would pour that water just boiling into a cup, blindfold them, and then pour ice water on their skin, and invariably the patient would receive, sometimes even receive burns, but they would claim that they were feeling hot when in fact it was ice cold. It's very important that everyone in the office is on board with these concepts, because if anyone believes that that patient is going to be in a lot of pain, that thought will be transferred to the patient. So be sure everyone knows that what you do is painless, and they will transmit that feeling to the patient. Now, all of this psychology won't help you very much if you are actually causing pain to your patients. So if you want to learn how to do painless endodontics, and you would like to know how to get your patients numb 98% of the time in less than 60 seconds, come to one of my root camps, and I'll show you how to eliminate the pain. Thanks for listening today. Keep an eye out for more pain information next week. I'm Dr. Kit Weathers. I'll see you at my next root camp. Ever have one of those days when you have this splitting headache pain and it just seems like everything's coming apart? That's today's subject, pain! That's not supposed to happen. 3. Ow. That's not right.